Direct Connection is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you. Live from Maryland Public Television, this is Direct Connection with Jeff Salkin.
Hi, everybody, and thanks for tuning in for Direct Connection. Later in our program, answers to your questions about restoring the Chesapeake Bay. But we begin tonight with the increasing incidence of skin cancer, how to avoid it and how to treat it. Joining us for this week's Your Health segment is Dr. Zainab Makhzoumi, Assistant Professor of Dermatology at the University of Maryland School of Medicine and Dermatologic Surgeon at the University of Maryland Medical Center. Doctor, welcome back.
Thanks, Jeff. Thanks for having me back.
Perfect timing. The summer solstice in 2 weeks. The sun's at its strongest in this part of the country, and from your perspective, I guess people aren't doing enough about that.
That's right. That's right. The time is here. And unfortunately, every year we're seeing just an increase in the incidence of both melanoma and non-melanoma skin cancer.
And we want to focus on the melanoma, which is by far the most serious type.
Oh, absolutely, absolutely. And so, you know, while there are 3 most common kinds of skin cancer, the 2 most common, basal cell and squamous cell, certainly account for the overwhelming majority of cases. They're not the most deadly. The most deadly is malignant melanoma, and the most recent estimates are about 80,000 new cases every year in the U.S., which doesn't sound like a lot, but when you look at how many people are dying of that melanoma, it's just unbelievable. I mean, it's about 10,000 people per year, so that's almost a 10% case fatality rate. So it's quite deadly.
Why would the incidence of that be increasing? I mean, as a civilization, we probably used to be outdoors more than we are today, and certainly it seems like people are aware you need to wear some sunscreen.
Definitely, and the good thing is I think part of that could be increased detection. And so while we're looking out for it more, maybe you could be seeing a slight increase because of that. I think mostly the true increased incidence we're seeing is because a couple of things. One is genetic mutations that are directly responsible for melanoma. Now we're discovering that some genes are responsible for that. And secondly, melanoma is caused by that brief intermittent ultraviolet exposure. So a quick sunburn you get, in 6 or 8 hours, even one sunburn doubles your risk for melanoma. So while overall we're doing better in covering up and trying to stay out of the sun, just that brief, intense sunburn, that's what causes melanoma, and that's what is quite difficult to control.
So everybody knows about that link, the sun causing skin cancer, but the genetic side of it, that's new.
It is, and it is the new part. But I also think that's the exciting part. That's where it's been quite exciting to be a practicing dermatologist while they're discovering all these genetic mutations for melanoma. And one of the most common ones, the BRAF gene. In 2011, vemurafenib came out, was FDA approved for it's a BRAF inhibitor, and so it's we're finding these new genes involved in melanoma. But the exciting part is we have targeted medications that can shut off that mutation, that can shut down the melanoma, which are used with surgery to really have a chance at some of these more advanced cases.
Okay, so obviously it's a situation where you want to prevent it. You also want to catch it early. Yeah. I have a couple of slides off of the cancer website that show some different things that can show up on your skin. And according to this website, all 5 of these lesions or bumps are described as moles. You looked at it and were a little concerned about one of them.
I was. We looked at this together, and I think certainly the top 3 in my mind are certainly maybe atypical, but they would not warrant, any red flags or alarms in my mind. I think the bottom one on the left has a little bit of concern to me. We talk about the A, B, C, D, E of melanoma, and so for patients, I try to always counsel them to look for A is for asymmetry. So any mole that you can't slice down the middle and have it look the exact same on both sides.
Mirror image.
Anything that's not a mirror, exactly, not a mirror image is concerning. Anything with the B is for border, so any mole with an irregular border.
That brings us to the next slide, but continue.
Yeah, anything within so this hits sort of all those points for melanoma. This has a very irregular border. You can see it's not nice and even. It's quite scalloped, so it's sort of ballooning out at the border. C is for color, so this has a lot of different colors in it. Benign moles should really have an even, soft, dark, light, whatever brown tinge to it, an even color. This has pinks and light browns and dark browns, even white in the middle, so irregular color.
Somebody watching, if you've got one of those, you need to do something about it pronto.
Yeah, pronto, double pronto. Yeah, absolutely. If you have, I as you were saying right before we came on, I don't know of any dermatologist who would just say, oh no, that looks great. Absolutely.
Okay, so you got as far as color.
And then D is diameter. So any mole with a diameter greater than about 6 millimeters. So just for size reference, that's about the size of a pencil eraser. Anything larger than 6 millimeters is a little bit concerning. And E is for evolution. And I truly feel like E is the most important, because that's where patients come in. I mean, I tell my patients that you're more likely to find your melanoma than me. If you're going to get melanoma, you are more likely to find it because you know your skin. You know your skin better than I know your skin. So any mole that's evolving, any mole that's changing, you should look at your skin once every 2 or 3 months. And anything you see changing, growing, that's when you want to give us a call.
Something like that melanoma we saw, how fast does something like that grow?
Good question. Sometimes on the order of 6 months, sometimes, a little bit longer. There's a subtype of melanoma called lentigo maligna. They're very slow growing. These types of melanomas typically grow over 5-10 years. But usually, if you're going to see a change in a mole, it should be within about 6 to 12 months.
Let me remind our viewers, if you have a question about skin cancer or dermatology in general, give us a call. The number's up on the screen. You can also tweet your questions. Our Twitter address is @MPT News. Let me ask a difficult question. So we saw those 5 bumps, which, according to the website, reputable website, were all normal moles. So there's degrees of levels of concern that a trained doctor would have. Do you go to your general practitioner, your nurse practitioner, your primary care doctor as a starting point with an issue like this?
Absolutely. I think that our primary care professionals, our primary care colleagues are truly on the front lines. And I think that they see way more skin than we as the dermatologists and skin surgeons do. And so I think that that's a fantastic place to start. But if your level of concern is heightened, I certainly think it would be reasonable to reach out directly to a dermatologist, especially if you have a risk factor for melanoma. A lot of things put you at heightened risk for melanoma. If you have a first-degree relative who's had it, if you personally have had it, if you've had blistering sunburns, those are sort of reasons in and of themselves to reach out to your dermatologist directly.
Okay, so we were talking before the show. I lifeguarded 1 million years ago, and I don't remember anybody using SPF anything. We had this zinc oxide stuff that was mostly to look cool, as opposed to the sun protection. But, we got burned all summer long, and you don't want that to happen to your kids these days.
Right. No, and times have changed. I have a lot of patients who come in for surgery who say that their parents had them out there with baby oil, iodine, and tinfoil. But no, times have changed now, and we know the tinfoil, thankfully, it's not all that often. But now times have changed, and we now know that even one blistering sunburn doubles your risk for melanoma, and it's really crucial, especially in those early years, to keep your kids out of the sun. And so now we're doing a better job. And I'm hopeful that we'll see, remember, it takes about 15, 20 years for a lot of that damage to accumulate. So it will be some time before we start to see that ring true on the back end and we start to see that fall in the incidence.
Tell me about the surgery that you do. It's a very specific thing called Mohs surgery.
That's right. So I'm a Mohs surgeon, M-O-H-S, and that's named after Fred Mohs, who pioneered this technique in the 40s. And really the beauty of what I do as a Mohs surgeon is that I don't just take a best guess where a skin cancer is and cross my fingers and say, okay, let's hope we got it. I only take what I see with my eyes, and then I have a lab down the hall, and I remove the tissue usually from the patient's face, and then I go down the hall. I have a technician who freezes the tissue for me, cuts it, stains it, and I look under the microscope, and so I see every single portion of that skin, of that epidermis and underneath. And so if there are any roots and traces to that skin cancer, I know exactly where they are. And so I go back and I take a little bit more, and we just keep repeating that process until I come back and I say, okay, we got it all. And then once I do that, then we do the reconstruction and we put everything back together.
Let's grab a phone call. Prince George's County, this is Susie. Susie, thank you for calling. Go ahead.
Hi.
Hi.
My question is, I am a black female, light complexion, and I was diagnosed with a basal lesion on my pubic area, and it's been removed. But I'd like to know how did that happen, and should I be concerned?
You don't frequent the nudist colony, is what you're saying.
No.
Okay. Susie, thank you very much for the phone call. We'll get you an answer on the air. Can you get one of these without the sun hitting it?
Absolutely you can, and it's not just ultraviolet radiation causing these skin cancers. It's also sometimes with basal cells genetic mutations. There are some genes, in particular the patch gene, that are mutated in basal cell carcinoma, and so it's not necessary. I mean, certainly the overwhelming majority of basal cells are on the head, neck, arms, hands, but absolutely, I would say at least twice a year I do surgery in the genital regions for a basal cell. And the darker skin you are, the more heavily pigmented your skin is, the lower your risk for skin cancer, but it's certainly not zero.
So if you have dark skin, do you still need to think about sunscreen and exams the same way?
Definitely. And that goes back to especially if you're predisposed to skin cancer. I mean, if you've, as Susie said, she's had one skin cancer. So Susie, you are for the next year to two at increased risk for a second. So if you've had a history of skin cancer, you're at increased risk regardless of your Fitzpatrick skin type. So definitely.
Baltimore City, this is Tammy. Tammy, thanks for the call. Go ahead.
Hi, how you doing?
Good, how are you?
I'm okay. I have two questions, actually.
Sure.
Okay, I have down around my ankle area and the lower heel of my foot, but not under the foot. They're like skin tags. That's the closest thing analogy I could come up with, and they're all different shapes. And they get very dry, and even if they itch, will pop off or something, but they always come back. And the second part of my question is also on my lower extremities of my legs, and it's mostly on the outer part of my calves. Now, mind you, I used to swim every day when I was a kid. I was out in the sun. I'm over 50. I was told this could be hormonal. It could be from the sun. Anything. I have these little, I don't, for lack of another word, I'll call them lesions, but they're not really, they're spots.
Tammy, let me...
And they're all oval type spots, and they're a very light tan, and they also get dry. So when I exfoliate, they'll come off and they'll get dry, but they always come back.
Tammy, thank you for calling. We'll get you an answer on the air. A little hard to play skin doctor when you can't see any of this.
I know. From what Tammy's describing, it sounds actually, Tammy, like both of these spots are what we call seborrheic keratoses, and they're very benign is the good news. The bad news is they're very annoying, and they're equally hard to get rid of. Moisturizing is a nice way to kind of keep them from getting dry and itchy. But the malignant potential, the chance of these becoming skin cancer is essentially zero. It's more just they're an annoyance and kind of tolerating it.
Still might want to have somebody take a look at it.
Definitely.
Yeah. We were talking before about vitamin D.
Yes.
So vitamin D is important for a lot of things, bone density, and one of the ways we get it is it's made in the skin. Sunlight hits the skin and some version of photosynthesis or something, right. you get vitamin D. So if we're all staying indoors, are we all going to be vitamin D deficient?
Right. And that is something that's so sort of trending, for lack of a better word, right now, because there are so many people walking around who are vitamin D deficient, and now it's, oh my gosh, have we gone overboard with staying out of the sun, and now we don't have vitamin D, and I think the consensus amongst, from the American Academy of Dermatology and, from dermatologists is that there you have plenty of sun exposure, even just on your hands for 5 minutes outside, for the conversion of, of vitamin D3 in order to absorb enough. And that's why we have supplements as well. And so I recommend all my patients to take a supplement of vitamin D. And if it's truly very critically low, then your physician can also sort of prescribe a higher dose of vitamin D. But it's not the vitamin D deficiency. It's certainly not a prescription for us to sort of go out free range, carte blanche, go outside and get some rays in there.
All right. So what do you tell somebody who likes to get some rays because they think it makes them the old healthy glow?
It's really tough. I think that who was it, Coco Chanel or whoever it was that kind of started that bronzed goddess look. I think that we're sort of fighting that stigma and trying to, I tell my patients that pale is really cool and it's really in right now. So, spray tans are great. I recommend spray tans to a lot of my patients if they absolutely have to have that bronzed look. They do the trick. So.
And you don't like tanning salons, I'm guessing.
Hate them.
Let's get another phone call here. Baltimore City, this is Sally. Sally, thanks for calling. Go ahead.
Yes, this is a public health question.
Okay.
I noticed something on my back. I went to a senior expo, and there was a booth there with nurses, and they looked at it and said, get to your a dermatologist. Well, I did, and they took care of it, and it was successful. The question is, where are the places that people can go to get a quick diagnosis like this? Because we are not always able to get to our dermatologist that quickly.
Great phone call. Sally, thank you very much. Glad you're doing well.
Yeah, that's a good story, Sally. Thanks for calling in with that. And I think that is something, access to care is something that we talk about all the time, and we know that it's sometimes hard. You pick up a phone and there's a 6-month wait with a dermatologist. If there's not a free screening near you, what I would suggest is going through your primary care doctor and making sure you tell them, hey, listen, I have a mole that's really, really concerning. All physicians know the danger of melanoma. They know that the risks at stake, and so they would be able to get you in quickly and hopefully make that appropriate referral to a dermatologist.
Good place to leave it. Dr. Zainab Makhzoumi of the University of Maryland, thank you for your time.
Thank you for having me.
Do appreciate it. Just ahead tonight, new efforts to protect and restore the Chesapeake Bay. We'll be right back.
Tonight on MPT.
Next time on Antiques Roadshow, it's raining cats and dogs.
We have never seen a cat.
Really?
And he's thoroughly delightful.
It's nice to see this little dog again. I've met it once before.
That's amazing.
Do you like cats anymore after that?
I'm beginning to love it.
You won't want to miss our special edition, Antiques Roadshow, Cats and Dogs.
Tonight at 8 on MPT.
Black Panthers.
The Black Panthers were absolutely unique.
Police jump on you, beat you up. This is what we were going through on a daily basis.
Now we have voices that we're not going to turn the other cheek.
Stop brutalizing our community or we're going to drive these pigs out.
We don't hate nobody because of their color. We hate oppression.
We wanted the entire community to fall.
Tonight at 9:30 on MPT.
Here's the buzz on the next Maryland Farm and Harvest. Everything from soybeans to cucumbers to watermelons needs bees to grow. Then let's go to the fair.
Have you ever pet a cow before?
The kids also get to vote on this little guy's name. Next time on Maryland Farm and Harvest.
Tuesday night at 7 on MPT.
In the studio now is Ann Swanson, Executive Director of the Chesapeake Bay Commission. Ann, thanks for being here.
Thank you for having me.
It is Chesapeake Bay Awareness Week, not to be confused with MPT's Chesapeake Bay Week. Talk about the idea behind it.
Okay, I'm the director of what's called the Chesapeake Bay Commission, which is a tri-state legislative commission, represents Maryland, Pennsylvania, and Virginia. And the members recently signed a Chesapeake Bay Agreement, And part of it was to really increase stewardship of Chesapeake Bay. And they realized, you know what, we really need a Bay Awareness Week that could really focus people on events, places they could go and interact with the Chesapeake, opportunities to learn or contribute. And so each state carried a piece of legislation declaring the second week in June Chesapeake Bay Awareness Week. So it started on the 4th, and it goes until the 12th, and there's events happening all across the Chesapeake.
Is it an easier task of making people aware of the importance of the Bay when they're close to the Bay, as opposed to the Bay watershed all the way up the Susquehanna into New York State? They're probably not thinking about the Chesapeake Bay on a daily basis.
So, you know, what I would say is when you talk about the Chesapeake Bay, yes, you're talking about the main stem of the Chesapeake Bay, and there, I would say it is easier for the people who live closer. But remember, the Chesapeake is a vast network of rivers, about 180,000 miles of rivers, and it spans 6 states. So at the end of the day, the Bay is defined by the rivers, and the rivers are what define its health. And everybody can connect locally to their river. So, you know, you were just talking to a doctor, and a doctor knows it's not just about the heart, it's about the skin and the bones and all the component parts. And the same is true for the Chesapeake. So if you live in Pennsylvania, you live in New York, you live in West Virginia, focus locally on those waters, because those waters define the health of the Bay.
So in building a plan for Chesapeake Bay Awareness Week, what's the strategy? What message are you trying to get out, and how are you trying to get it out?
Okay, well, first of all, we see it a lot like Earth Day, which is we hope it'll grow organically, that over time different people will do events and they'll anchor them there. And the other thing is we hope that there are other complementary activities like MPT's Bay Week, where you're teaching about the Bay that week and raising awareness. And then during our week, you actually do something to contribute to the Bay's health. So what we hope over time is that people join a cleanup, people plant a tree in their yard, people interact with their local government officials where most of the decisions are being made. People do something that will contribute. And ultimately what we're trying to do is to protect habitat, protect the forests, protect the river shorelines, or reduce the pollutant loads, because Chesapeake Bay has very serious nutrient and sediment pollution problems, and there are 18 million people in this watershed contributing to that pollution.
Well, let's grab a phone call from Baltimore City, part of the watershed. Duke is on the line. Duke, thank you for calling. Go ahead.
Yes, I'm calling because I want to thank you first off for your effort and what you're doing, and I really applaud you saying, you know, as being having the only estuary that's in the largest in the United States. But what I needed to find out was, why is it that when cities like Baltimore City have federal consent decree orders and they're dumping literally somewhere around 15 million plus sewage, just for instance, the Jones Fall River that goes into the Chesapeake. Why are they not taking on the technology that is available to them in order for them to do the cleanup and to help with the cleanup of the Chesapeake Bay?
Duke, thank you very much for the question. Appreciate it.
So that's a great question, and it touches on different things. The first is Maryland actually has one of the most progressive funds in the nation to pay for upgrades to sewage treatment plants. And so all of the 66 majors in Maryland either have or are being upgraded. Now, a consent decree is negotiated when they are not meeting their permits and they need to upgrade or change technologies in order to bring them into compliance. And sometimes that takes several years. What I would say to you is the fact that you are aware of that, the fact that you are asking questions can mean a lot. A squeaky wheel is important and gets attention. And so what I would say is keep asking those questions at the local level.
Right there. Ann Swanson of the Chesapeake Bay Commission, thank you for being here.
Sure.
And thank you for joining us for Direct Connection. We're back Thursday with Your Money in Business. Have a good night.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.
This program was made by MPT to serve all of our diverse communities.